now that you are here, we want to know exactly how this works, the machine works, and then how in the cellular level it works in the body. What is this, all these gadgets about?
Well, I try to make it as simple as possible. We all know, oxygen is very important, and thanks to COVID, we have realized the importance much deeper. So whatever we have been getting it free, now people are paying for it. So keeping that aside, so this is a therapy which doesn't include any medicines, any surgeries, any pricks, anything else. Just oxygen is the drug. That's what we use it, and we play around with oxygen in three forms. One is the pressure, another is the dosage, and how long the patient should take the treatment. Depending upon the clinical condition and indication, these three things varies. So, for example, if you take a tablet, the same tablet is prescribed for one indication for X number of days and doses, and for another indication it's prescribed for longer time and high potent doses. Same. So here we consider oxygen as a drug, which is a natural form. And these are all the things what you showed is all pressure gauges to monitor what is the pressure inside and what is the duration, how long they should take, all those things this gadgets indicate you. Okay. And operator is very well trained and they operate this machine and interacts with the patient. So patient will be lying inside, but patient can see a movie, talk to you or a phone, everything else, and they can be as comfortable as possible. Absolutely not a problem. So basically we use oxygen under different pressures to treat different clinical conditions. And there is a protocol for this, which is very well developed and established and accepted.
Very good. Where else have you installed these kind of installations in the country?
See, this is basically, it is used for multiple setups, right from biggest hospital to smallest clinics, and where and how they use differs. And right now it is being used in big major hospitals in India, right from, you talk about AIMS, like all medical sciences, which we probably know, in Delhi, Rishikesh, and so on and so forth, and many medical college, teaching institutions. And where they see a diversity of patients with different clinical conditions, they use it. And also in corporate hospitals, for example, like in Manipal Hospital and Vijaya Hospital in Chennai, and Kokilapet Hospital in Mumbai, Godrej Hospital in Mumbai.
Wow.
So many hospitals it is. Then comes the mid-level hospitals. If you take in around surroundings here itself, we have in Tamil Nadu itself. In Coimbatore we have in Salem, we have in Nagarkovil, we have in Tirunelveli, and so now this is spreading to even tier 2 cities. It's not a mission which is available or of a premium only for metro. This has been penetrating. Why? Because tier 2 cities, even the small cities, see the benefit in this. Where the big and very high profile surgeons are not available, if this machine is available, the surgeon can direct the physician, general physician or a surgeon who is available to treat all these indications. So it is now well penetrated. In India, it is available approximately in 75 to 80 hospitals now.
Lovely. Lovely. So from the head to foot, I think all kinds of conditions it is treatable. You just told me that it is good even for patients post hair transplant. That's news to me. It's not there in one of the indications. And so like this, what all indications is it being used for? From head to foot, if you can say.
Yeah, it's basically wherever the blood flow is not there in the body.
Okay.
And that is where the problem starts. Okay. Because blood is required at every cell level. So we know the cell forms, tissues, and so on and so forth. We don't want to go very scientific. So at the cellular level, what is required is oxygen. So that oxygen deprivation, we call it, is the oxygen is not supplied when there is a blockage in the arteries. In those cases, this therapy really works. Okay, under pressure, oxygen dissolves in all body fluid, not restricted to the blood alone and hemoglobin alone. So that is why whether blood flow is there or not, the oxygen reaches the site where it is required and promotes healing, promotes regeneration of cells. That is how the basic fundamental it works. And if you talk about indications, so primarily used for all diabetic foot ulcers, neuropathic ulcers, and lot of wounds, and surgeons use it for flaps, reconstruction, and injuries, all type of injuries. It promotes healing. Heart is used for surgeries. They use it. CABG, and those kind of indications they use. So when you talk about the indications, there are about 15 indications which are very well approved worldwide by European Union, UHMS, which is the governing body of hyperbaric oxygen therapy worldwide. They have listed 15 indications. Beyond this, there are select countries like in Australia, China, South Africa, Japan, so in Germany. They have added few more indications based on the clinical studies and success formula what they have got it. So in all these indications, hyperbaric is very well used.
And one is, you said very interestingly, for treatment of ailments in illness. And other is for wellness also, you said. That is even more interesting, I thought. Before getting ill, when you're well itself, to become even better, it's being put to use for people with sportsmen are utilizing it, actors, actresses, to keep their skin rejuvenated and shining, their age being lesser than what they actually are, for those people also.
Yes.
Now post-COVID, also when they are very tired, it is being put to use. These are the things which you said, which during the interaction with him, I have got. So, what do you want to tell the audience about this?
Yeah, these therapies are very well established therapies, and these are absolutely safer therapies when administered in a good hospital like this under very eminent doctors who are trained doctors and trained staffs. And these therapies not only treats a particular indication which you came to the doctor, it gives more holistic benefit, we call it, and that's why in medical terms we call it quality of life. So even though your X indication is treated, still if you are not mobile, still if you are having some other problems, it affects your quality of life in a day-to-day living. And here it helps to improve the quality of life. For example, this particular patient, gentleman who will come for diabetic foot ulcer, he may be having the other benefits of there is pain disappearing, unexplained pain sometimes. I'm not promising, but it happens. This is what the studies say. That's what the clinicians say. This is what the patients say. So based on their collective experience and information, we are sharing what is.
And that is the most important thing.
Yeah. So it improves the quality of life, sir. So that's how it benefits. So take this treatment confidently with under good medical care and supervision, and definitely benefit you a lot. So, and definitely you will enjoy the benefit of it, and you will come and tell what is your experience, and that is what I look forward to.
Fantastic. Yeah. So thanks a lot once again for bringing such wonderful tools and at a very affordable price as well. So Indians are very thankful to you, and we'll wait for more such innovations. Thank you.
Thank you very much for the opportunity. Thank you so much.